Good morning. Today is Wednesday, July 16, 2025. This is a meeting of the County of El Paso Women's Commission. Would you please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item number 3 is public comment. We do not have any speakers signed up for public comment. We will take no action for item 3. Item 4 from the regular agenda, 4A. Approve the minutes from the June 25th, 2025 meeting.
Good morning, Commissioners. Michelle Cochran with County Administration. Let me just share this on the screen so everybody can see. Here are your minutes from the last meeting. If you haven't had a chance to review them, we approved the Women's Commission annual report, and that was submitted to Commissioners Court on June 30th. And then the summit was actually, the consensus was to postpone it until 2026 instead of this September, just to give it the time and attention that it needs to be the event that you all envision. And then on today's agenda, it was requested by Judge Chu to place an item on to discuss the start time and duration of the meetings. If there are not any corrections or questions, I would request a motion to approve.
Motion. A second. Commissioner Gisareno Zamora. Aye. Commissioner Bird. Aye. Commissioner Paz. Aye. Commissioner Chavira. Aye. Commissioner Rodriguez is absent. Commissioner Chu is absent, and Commissioner Harcourt. Aye. The motion carries. Item 4B. Receive a presentation from NOVA's Military Coordinated Community Response Program.
Good morning, Commissioners. Michelle Cochran with County Administration. I was asked by Commissioner Harcourt to add this presentation to this month's agenda. We have Kimberly online. Commissioner Harcourt, would you like to introduce the item?
Yeah, sure. So I asked for Ms. Kimberly Henry to give us a presentation because I had never heard of it before, NOVA, but you know of it, right? No, can you tell me what it stands for?
The National Organization Victim Advocates.
Yes, for victim advocates. And Ms. Henry is, she's for the military connected survivors. So it's veterans, those like even like military spouses, etc. So I'm sure she'll, of course, give us a more further in-depth presentation. But I thought they were a great resource when I learned about it. And if possible, I'd love for them to be able to come to the summit, you know, when we decide to have it. So you can take it away, Kimberly.
Can everybody hear me okay?
Yes.
Okay, great. All right. Thank you for having me here. Again, as I stated, my name is Kim Henry. I'm located in Cristobal. It's right next to San Angelo, Texas. But as I stated, I am part of the National Organization for Victim Advocacy. Specifically, I work on a project titled Advocating for Military Connected Survivors. So I have a full PowerPoint presentation, but honestly, we do a lot of them and we have a lot of tools and tip sheets. So I kind of really want to summarize what we do and what our project's about. We are currently funded by the Department of Justice Office on Violence Against Women, which allows us to do trainings, develop tip sheets, provide technical assistance, essentially consulting for free for organizations, communities like yours. And so we have a mission statement that I'll review here in a moment. This is primarily our team. We do have some additional support, but Dr. Ramirez, NA, and I, she's a Marine Corps veteran. I'm a Navy veteran. We are both the coordinated community response program managers, and we work together on this project, which is supporting, advocating for military connected survivors. A lot of times when you hear the word military, you think of combat, uniform, honor, dignity, service, regiments, structure, right? Chain of command. We ask a lot of people in a lot of presentations what comes to mind when you think of military. Sometimes people say PTSD, sometimes they bring up the mental health, but a lot of times what gets left out is talking about the other forms of trauma in the military. It's not something people want to associate with the military, and we recognize that. But what that can do is that can leave out other experiences, and it can further create harmful stereotypes. And so the military connected survivor, as we define it, is any of the individuals listed here who experience domestic violence, dating violence, sexual assault, and stalking. And as you can see on the left-hand side, it's very common that we think of the active duty, National Guard and Reserve, our veterans, and civilian dependents. But on the right-hand side, we also are talking about intimate partners. And this is common in areas like yours as well, just like, San Angelo and other areas where there's large bases, where you may have people who are service members and maybe they're dating somebody, or they just share a child with somebody who is in the military or who is a veteran, but they're not married. And as you know, working in the work that you do, if you're not married or if you're not an official dependent, you actually don't have access to a lot of services and programs. And so when you consider things like domestic violence and sexual assault, intimate partners have almost no help and no access to resources. So the entire mission of our project is to provide education and training or technical assistance to legal personnel, to victim advocates, allied professionals. That can include healthcare providers. I just had a training with sexual assault forensics examiners. We talked to veteran treatment courts. We talked to law enforcement, other court personnel, community providers about what military connected survivors need. And it's really, again, to support these military connected survivors of DVSAS, domestic violence, dating violence, sexual assault, and stalking. We do this, again, through some tip sheets and toolkits, which I'll review in a moment. I'm not going to go through all of these, but when we do our trainings and our tip sheets, we really go in depth on what are some of those unique dynamics and challenges. This is important because when you think of veterans, for example, me as a woman in West Texas, I had a service dog. She recently retired. She is 10 years old, and I've had her for a long time, obviously, her being 10 years old. And I did 10 years in the Navy. I look fine. I don't have any physical visible disabilities, but I am very open about having PTSD and having non-visible disabilities. However, I've also adopted children in Texas. I have my master's and my license in social work. I own my own business. I am married. Have a Girl Scout troop, a bunch of other things, right? And so I've actually been asked, how can you do all of those things or any of those things, including adopt children, if you need a service dog? How can you have a master's degree if you need a service dog? And so it's interesting because having a service dog is one challenge, right? Having the disabilities as a veteran, there's already those stereotypes. But the first question that I always get asked when people see me with a service dog is, were you in the military? And I don't even have that brown tactical vest on her, right? I just have a gray one. She's a black lab. And that first question is always, were you in the military? And my answer, of course, is yes, I was in the Navy for 10 years. And the second question I always get asked is, did you serve in combat? And let me tell you why that's a big part of what we talk about with this project. Yes, I was in combat twice, technically in the Red Sea, and then also in the Gulf. We were dropping a lot of bombs on ISIS when ISIS first started doing the things that they were doing. But I was also in Japan on land during the tsunami in 2011. And so I tell people that, yes, I was in combat. I was also in Japan during the tsunami. But I'm immediately justifying my mental health and my need for a service dog as a veteran because of my non-visible disabilities and my service. What that does is also furthers the stereotype of why I need a service dog because I have non-visible disabilities. It also minimizes the trauma that I experienced as a military sexual trauma survivor and the extreme retaliation that I faced following reporting my sexual trauma. And so what that does is that creates kind of those stereotypes and that mindset, which further creates more barriers from survivors, especially veterans, and honestly, women veterans as well, from receiving help. And so those are just some of those unique dynamics and challenges that we talk about with this project and when we're doing our training and our technical assistance. So you can see some other ones here as well, thinking about like financial and benefits. We once had an organization out of Georgia reach out to us, and they said that we have some victim advocates and they're helping domestic violence survivors, but they live on base and our advocates can't get on base. We don't want to just, send the victims back to base to get their items on the on-base housing. We can't get on base, so how do we help them? And my response was like, that's actually a great question and a great topic for a training. So for free, we developed a training for that organization, and we are currently working on making it a national training on how to navigate on-base and off-base housing for community advocates and how to coordinate with military agencies to make sure that, if a survivor needs or wants to get back onto base or on-base housing to safely get items, how to do that, but also do it without taking their reporting options, and also how to make sure they actually have rights and access to financial benefits like housing allowance. And how do you actually navigate that, especially if they're spouses or even if they're not spouses, but they share a child dependent. And so, again, people just asking us questions like that, we've developed training based on that. A common topic we have is military protective orders, especially with veterans. How do those work? So we talk about topics like that as well. Another item that's a root really of this project is coordinated community response teams. I'm sure you all have worked or heard of like sexual assault response teams or mental health crisis teams. Well, coordinated community response teams, if you're not familiar with those, really, it's kind of like the overarching of all of those. It brings all those teams together to make sure that there's a coordinated response. And a lot of times, I don't know if you've ever felt this before, but a lot of times military or veterans are kind of left out of some of those teams. But sometimes there's a mindset that, well, the military, they have enough programs. The VA, they have enough programs. Like we don't need to, they got their people to take care of. And so when working with community advocates, we work with them to help them understand there's a reason why people come to you for help rather than going to the VA or to the Department of Defense. And we talk to the DoD and the VA and tell them you have got to reach out to your community partners. So again, we provide kind of that facilitate those connections and those partnerships to help communities work together as a team. So here are some of the tools and the resources, some examples. Again, we have topics on supporting military survivors in rural communities. We do a lot of training on risk assessment and safety planning. We also we partner with the National Crime Victims Law Institute. They're one of our main partners, and they are the legal gurus when it comes to anything military connected. So military protective orders, the veteran treatment courts, working with veterans, the UCMJ, everything legal. So they are our law partners, the military criminal justice system. They are they're all lawyers and they're very smart. So they're our go-to for anything legal. They also have training on, a lot of people don't know this, but there's access to free lawyers for survivors. And there's also ways that lawyers can become involved in those activities and become basically volunteer as a pro bono lawyer for survivors. And in areas like yours, and again, being here in the Tom Green County area, so areas like ours, we need those lawyers. If you were to call and ask, if I were to ask you, who do you call for a survivor of domestic violence who's connected to the military? As a lawyer, who would you call? The list is not very long. And so if you're a victim, how do you think that victim feels, right? Especially as a veteran, especially a veteran who may still be connected to someone who's active duty. That list continues to get smaller. So they help with that. I talked about the housing consideration training. I do special trainings on military connected survivors and the intersectionality of disabilities. Talk about the veteran treatment court process. We actually have a training series coming up for free that you can be invited to attend for veteran treatment courts, the judges and court personnel. So that's in the next few months. And then we also have done some vitality reviews. So most recently we did one in New York for the New York State. Unfortunately, there was a murder of active duty service member had murdered his wife. There was a lot of domestic violence and mental health issues in that case. He was arrested and convicted, but we did a fatality review on how does domestic violence and combat service, military service, how does that all interplay and what the ultimate outcome was. The last couple of slides here, again, I'm going to send these to you so you can download these, but this is one of our foundational tools. It's a self-assessment. And really what it is, it's just a tool for you to say, how prepared are we to support military connected survivors? What does your office look like? Do you have posters that say, do you have a poster that has a man in a uniform in the corner with a dark light and alcohol bottle and a gun in his hand looking depressed and saying, we're here to help you? Because I promise you, no veteran or military service member or person connected to the military wants to walk in and see that and feel like you're there to help them. They don't want to be part of that stereotype. What does your team, how do they communicate about the military? I've been in bases and areas where they're very vocal in the community that they do not like the military. I was just in Hawaii where there is a very strong tension between the military and the local community. And that, what does that do for survivors? Survivors will not get help either on the local side or the military side because of that. So this tool you work through with your team and it helps you really assess how prepared are we to support military connected survivors. And then you identify whatever gaps you have and call us and we'll help you. This can help you develop some of that CCR team to work together. We have an MOU template. So we've had community agencies say our base will not work with us or they don't want to call us. And we've had the base also tell us that before. And we've also had community agencies say, we work well with our base. We do all kinds of stuff. And we ask, oh, great, what MOUs do you have in place? And they say, well, we don't have any. That is not good for protection. So we have an MOU template. This can get you started just having that conversation. This is also a listening sessions report that we did. We did have a conversation, kind of a listening sessions with veteran treatment courts. Working with veterans, especially, with women veterans being the statistics that veteran treatment courts are there to support the veteran offender. However, if the veteran offense is domestic violence or sexual assault, it's not that other crimes don't have victims, but in the case of domestic violence, sexual assault, dating violence, and stalking, if the veteran treatment court is there to support the veteran offender, then what does that mean for the victim of domestic violence or sexual assault? And so there's actually a lot of debate on if veteran treatment court should even hear these cases. And there's no consistency or guidance, to be honest. And so this report discusses that. And that's what the upcoming trainings are about. So I'll stop there. I know I've thrown a lot at you, but ultimately we're just here to help. This project is the only project of its kind. We are very heavily advocating to continue this project through the Department of Justice currently with what's happening. But it is the only project that provides free training and consulting and connection building and community building for community advocates. We do not train the Department of Defense. NOVA, the National Organization for Victim Advocacy, has many, many projects. We have a crisis response team that actually is in Kerrville responding. They set up the Family Response Center. They respond to and train communities on crisis response. They responded to Uvalde, the Pulse nightclub shootings. It's incredible. I'm not on that team, but they do a lot of amazing things. We have college campus projects. We have many contracts with the Department of Defense. All of the sexual assault victim advocates in the Department of Defense are credentialed by us. You as civilian advocates can also get a national credential through us. We have an annual conference that's about to start. So NOVA we are here to support you. People ask us, oh, what do you do for victims? And I tell people, we don't help victims one-on-one. We don't do direct victim care. We help the helpers. We help those of you that are on the ground doing the work every day. And so whether it's training or creating a guide or helping facilitate partnerships, advocate for policy. We have been a huge part in the Victims of Crime Act. Our executive director essentially helped write it. Our initial executive director, or just advocating for funding and advocating for more support in the work that we do and the work that you do. So we are here to advocate and support you in whatever you need. So I'll stop there and ask, does anybody have any questions or thoughts?
This program, is it for men and women?
Yes, so this is for everybody. Because of things that are happening, we're having to be, I would say, aware of certain terms. But me being a member of the member of the LGBT community, I'm married to a woman. I recognize that the statistics and the conversations that are happening within the military and outside the military, and the veteran community, the change in the VA's new bylaws. There are a lot of things happening right now. But this project, being that it falls under the Department of Justice, if it is continuing to fall under the Department of Justice, we are to abide by, of course, the executive orders. And so there's certain guidelines that we have to follow, but it's not just for women veterans. It's for any military connected survivor of domestic violence, dating violence, sexual assault, and stalking. We are about to launch a brand new website, which has it's like an online resource center, and it has all of our recordings, our webinars, our tools. We have some trainings about certain populations that are not publicly available, but people email us and ask us for those, then we can share them. So that's possible as well at this time. But for the most part, everything on our website and everything that we provide is open.
Thank you.
Yes.
Sorry, we have a question regarding, I work with the Center Against Sexual and Family Violence. We run into issues, I don't know if you address this at all, with your victims being reprimanded as a victim. If they were involved in an incident where they were maybe drinking when they shouldn't have been drinking, or those type of situations, but then a sexual assault occurs, but they were actually reprimanded as a victim in the military.
Yeah, so we talk about that a lot. That's a great question. We talk about institutional betrayal and retaliation. So the DoD created a policy of almost 10 years ago now, where essentially it was meant to encourage reporting regardless of the victim having like parallel like instances where they were maybe having misconduct. So like underage drinking. So maybe they were a victim of sexual assault, but they were also underage drinking. Unfortunately, there's not very strict guidelines in that protection. And so when we're training community agencies, especially law enforcement, we are very proactive in communicating with the law enforcement, with legal personnel, with community like family advocacy centers or family domestic violence shelters and rape crisis centers, about communicating with their base, and saying, we want to support any victims that come to come and request support from us, because they're going to most likely come to you. And that's, now I'm not going to say the number one reason. There's not data to support that yet. We're pushing for that. But with my experience being a victim advocate for 14 years now, both active duty and as a DoD civilian, one of the number one reasons that I've observed why victims go out in town to get support from community advocates like you instead of on base is fear of getting in trouble for something that they did, even though they were the victim. And it's usually something like underage drinking, and even being maybe drugged. And they didn't know that they were drugged. It wasn't, it was non-consensual, even being drugged. And so what we do when we talk to community advocates is we share with them kind of tactics on how to communicate that with the base, what the memorandums of understanding are, how to support community advocates. In some states like California, if you go to the hospital out in town, like the ER, it's mandatory they call law enforcement. And so you don't get to keep your report restricted and private and confidential. Whereas here in Texas, this just happened in San Angelo, where someone a sexual assault victim, domestic violence victim, can walk into the ER, who's in the military or, dependent, can walk into the ER and say, I want a sexual assault forensic exam, or I'm a domestic violence victim. I want medical care. Don't call anybody. Don't tell anyone. Don't call anyone. They could even call the Family Advocacy Center and ask help from you as a victim advocate out in town and say, don't call the base, don't call anybody in the military. And they have that right. But it's really important that there's that cross training, and we provide that training as well. So community agencies know you can do that. You don't have to just immediately call base law enforcement, which is what happens. And then that takes away the reporting options, which will then possibly lead to it coming out that victim was underage drinking. And now there's that fear that they're going to get in trouble. Yeah. So I will say that I'm not going to say that it's, significantly decreased. It has decreased. It's very much more vocal now, that we want, the idea that we want, I say we as in like leadership in the military and the DoD, we want you to report. It doesn't matter if you're underage drinking, like we want you to get the help that you need. However, it is challenging. When you're in the Department of Defense as a service member, as a spouse, as a dependent, I'm sure some of you are military connected one way or another. You're part of a system, right? I tell people in the Department of Defense, you could eat, sleep, check your mail, buy toilet paper, work out, everything on the same base in the same community, right? And you don't leave that community in a sense. And if something happens to you, like domestic violence or sexual assault, like how are you expected to respond to that and feel safe and feel like you're going to be free from retaliation? It's very, very difficult to feel that way. And that's where institutional betrayal comes in. And that's where we see a lot of the mental health challenges. So. And even at I guess the last thing I'll say is even at the VA, you can't just get diagnosed with like military sexual trauma. You essentially have to be diagnosed with like PTSD or like a clinical diagnosis because of your military sexual trauma. So a lot of times it requires service members or veterans to talk about their trauma prior to being diagnosed with their non-visible disabilities.
Because we do have many clients that are dependents of the military, and that's one of the reasons they come to our organization, because of the confidentiality and afraid of retaliation. So that's definitely something we can work on.
Yeah, and yeah, go ahead.
Sorry, Kim. I'm sorry. It's Melissa Hartgrove. I have one question for you. Are you at all right now affected by or expected to be affected by funding issues or anything of policy issues or anything of the sort?
Yeah, so NOVA, like I said, we have many projects. One of our projects, just completely lost the name of it, but it's for our college students, the Victim Advocacy Corps. We set up a cohort of college students who are essentially like the new generation of victim advocates, is funded by the DOJ, and they were one of the 360 projects that were cut the last couple months. And so that's unfortunate. This project has been funded for the last 6 years. It is, the grant essentially closes in the next couple months. And so of course you have to reapply for the grant after it closes. And so we're hoping that that solicitation drops. But previously this year, I think in March, OVW, the Office on Violence Against Women, canceled a lot of their solicitations. So we're just on standby and waiting. But NOVA's very committed to supporting military connected survivors. Like I said, we have contracts with the Department of Defense. We have other veterans, military connected individuals at NOVA. And like I said, this is the only project of its kind that provides free training to community advocates on military connected survivors. So we're going to keep working on it.
Is there on the website, or if you know, like if there's like a list of organizations that we could refer people to? I mean, of course, I know custody. Is that on there?
For like direct victim care?
Yes.
Yeah, so that's actually a great question, because I kind of just had that idea the other day. We have a help desk on NOVA's website because, again, people do ask us for direct victim care. A lot of times, probably 40 times a day, we get asked questions for direct care. Recently, it's been a lot of like digital cybercrime or like blackmailing, but they'll ask us for that, and we directly connect them with some national or state, sometimes regional area services and programs, because we have a huge reference list for that, but it's not public. And so I'm actually working with the team to possibly create like a public resource list for that, because we vet all of them. And so right now it's mostly we connect people to coalitions, but yes, that's a great question, because I do want to create that to be more publicly accessible instead of it just going through our help desk. But people can connect to NOVA at any time of the day, and we'll get back to them, if not right away. Because our staff manages our help desk. It doesn't go to like a robot or anything.
Okay, thank you.
Yeah. So if you have any other questions or thoughts, again, NOVA, NOVA does a lot. We're here to support you, to support the victim advocates and the communities, and the amazing work that all of you do. It means a lot to me for the work that you do, especially in the area that you're in, and being in Texas. And I say we're isolated. I know that Texas loves its veterans, that loves the military. But that can also create some challenges, right? Like, oh, veterans have all the support they need. And I think we know that doesn't always mean it's the support for everybody, and the support for the victims and the people that we work with. And so if there's anything or any questions that you have, and if you ever say, well, can they help with this? I don't know, just please reach out to me. I'm a local resource connected to national agencies. So please don't hesitate to reach out to me. We have a stalking training series coming up on military connected survivors and stalking. which is a very, very under-researched, under-discussed topic. So I'm very excited for that training series. All of our training has CEUs. So if you can give me a list of emails, I can give you all certificates. Almost every time our training gets certificates, it's always accepted by state licensing boards. So please let me know the emails of everyone here and I'd be happy to provide certificates.
Thanks, Kim.
Good day.
Thank you.
Thank you.
Yep, thank you.
So no action for item 4B. Item 4C, discuss the planning of a potential summit to include topics, stakeholders, and county resources.
Good morning, Commissioners. Michelle Cochran with County Administration. As I discussed during the review of the minutes at the last meeting, it was decided that the summit should be postponed until 2026 in order to give it the time and attention it needs to be the event that you all envision. So I know we're missing a couple of minutes today. I don't know if anybody wishes to discuss it further. Just as a reminder of what was discussed last time, we talked about doing subcommittees again. Our attorneys reminded us to keep it under quorum, and then you all could meet whenever you wish. It was discussed to do that, to split up reaching out to stakeholders and things like that for the coordination or donations for the auction or whatever it is that you had in mind. So if you all wish to discuss, this is the time to do so for that item.
I'll say something about it. Last month when we did meet, because with this being a summit and we have so many agencies that we want to be involved in, that's why we talked about postponing it until 2026 for the simple fact that we need to focus on how we want the summit to run, who we want to invite, but we also have to focus on invites. We have to give them a time limit to let us know if they're coming. If the specific person is not coming, who's going to represent that agency. So that's why we came up. That's why we were discussing that it was too soon to try to put this all together in September because some of y'all work. And, even though we want to do separate committees, you still have to have time to actually meet with each other, discuss things with each other, bring it back to the body, and then for us to discuss it with all of us here. So that's why we were so wanted this to be our best summit since it's our first summit, because it will truly be a reflection of all of us as a board. So therefore, we can take our time, since we've had so many speakers and everything, to be able to, we can review a list. Maybe we can make up a list of all our speakers, who they were and what agency they represented. Will you be able to put that together?
We have that already.
Good. And then that way, each one of us can be given a copy of it. And then on one of our meetings, we can say, okay, we're going to go over this list of who we've had speakers. That way, we will pick out the speakers that we want to invite, even though we can even have the other agencies to come. But we know we're not going to have everybody who came as a speaker to be a part of the summit. But we have main ones that we want to look at. And then that way, when we have a list, we can actually say, okay, we want this one to come. And we want this one to be a speaker. Or we want this one to have a table. Then that way we are more critiquing the summit, so that when we be ready to put everything together, we can discuss about the invite, how the invite is going to be written. And then once we start doing those things, then we set a timeline of, okay, the invites are going to go out on this day. We want a response by this day. If we don't get a response by this day, we will respond to them by this day. And I just think that's why we actually need more time on this. This is my personal opinion. So don't hold me, don't hold anybody else to it, but that's how come we were discussing, because we don't want to throw something together and look like a bunch of crazy people. And be like, oh, well, that's the one before you. No, we don't want to be labeled like that. But that's all I can say.
We don't have a working document right now for the summit, do we?
We do,
Oh, we do?
and I believe I shared it via Teams. Let me just make sure, but I believe I did, and y'all confirmed for me. But let me.
Yes.
Yes. Okay. Thank you. I can't remember.
They share it through Teams, how do I?
You get an email with the link to it.
Okay, so
Was there discussion on the more or less when we wanted to put this together?
There was just
Actually,
2026.
No, we didn't feel it would have been right of us to say, oh, well, we're gonna have it on this date, because we wanted more of us here, so that we can discuss the date and everything. So that's how come we only, actually in a broad range, talked about the summit. We didn't say, okay, we're gonna have this date. We didn't do that, because we wanted everybody else here.
Is there any way, and this is just a suggestion, that we can meet to have a working type of meeting? Just around the symposium? So that is the only part of our agenda?
Of course, Commissioner, just like you have in the past, we can call either a special meeting to specifically be a work session, like we've done those all-day ones,
Yeah.
or whatever time frame you decide, or your next regular meeting that can be the only item on the agenda. It's completely up to you. I think we need that. I agree.
I think so too. And to piggyback on Commissioner Byrd, I think this meeting is already set in our schedules, so it's easier for us to make these versus committee meetings. So if we make them working meetings, so that may be probably more productive.
I agree. Well, like I said, I'm retired. Commissioner Chu is retired, but we know the rest of y'all work. And, we always be, oh, we'll let the ones who decide who work to make it easier for them, because, we want this to be a success. And I think I agree with you as far as our meeting, this meeting, we don't even have to have it every single meeting. We can pick, okay, we're in the month of August. September, let's just say September. September's meeting, we're only gonna talk about the summit. The next one may be December's meeting. Okay, we're gonna go back and we're gonna see what we have decided on and what we have put together from that meeting. So that, and the only reason why I have the suggestion of not doing it this meeting and next meeting and next meeting is because then that way we'll still be doing things as us being a board in the middle, so that we can keep it going and we still are a work in progress as of us being on the Women's Commission anyway, even though we have other things that we have to decide and talk about, and that way we can keep our commissioners up to date on what we have decided. That way we can, if we say for instance the invitation, okay, we want the invitation to say this, this, and this. Okay, somebody, I don't know who, will design the invite. Okay, well, we have the invite set. All right, that's one thing off our list that we have to do. The next thing will be, all right, we're gonna go down a list of who we want as speakers, who we want as a vendor, to have a vendor table. Then that way we just sit and then we discuss that amongst ourselves, and then let's face it, some of y'all got small kids still at home. Then, you don't want to meet other meetings because you may have other meetings with other organizations or with your job and everything. And I think that will make it easier for those who fit in those categories. Even though me and Linda, we have 1,001 meetings, but still, we have to be realistic in applying our time with consideration. So I agree with you that these meetings are the best time, because even if we say, okay, well, this meeting, let's make it an hour extra. Then that way we're doing it in advance. And those who have to leave here and go to work can say, okay, I'm taking off work extra hour on that day so I can participate in it. Because to me, it's a lot easier to talk with everybody when you're here than trying to make extra meetings all the time, because we have busy lives.
Your next meeting is scheduled for August 20th. I don't know if that's the meeting you all would wish, or if there's consensus on making that a working version specifically for the summit.
I mean, whatever we need to do to make that happen, I think it's time that we do that. It's a great idea. But it's time that we dive in and see where to start again.
Okay. If there's consensus for that, then we'll just make that the only agenda item for August.
Yes.
So come prepared. I'll resend the link for the working document.
Thank you.
And I'll send out, I believe, the list of stakeholders, but I'm sure that document includes the list of 34 stakeholders you all had identified.
Right.
Okay.
I have a question. A summit, like what exactly is a summit? Because I hear like we're doing summit, I hear conference, and, like just all over in my work sphere. So I'm always like, what is the difference between that? Do we know?
I think I'll try to answer that. Correct me if I'm wrong, Charles. But I think the idea is to have both resources and discussion. So that would make it a summit versus a symposium where it would just be a panel of people discussing and then other people learning, right? So I think the idea we had was to connect all the resources together to see where the gaps are, and then be able to produce a document that all the resources could share. So we're all aligned. So it actually has a very specific goal. Am I making sense?
Oh, so you mentioned panelists. So, okay. Because I'm thinking last year we did one for all the organizations that provide services for veterans.
Yes.
And it was like that. We had panels and then breakout sessions as well. And that's the opportunity to ask questions,
Yes.
take your notes. Okay, here's what we've identified. And we did have vendors outside as well. Okay.
That makes sense. And if I may, when this idea came up, it was in January when Catherine Jones, she's the director of the Criminal Justice Coordination Department here at the county. She had shared with the commission that she coordinated something like this in a previous position of hers, and it was to get exactly what you all have been trying to do, the community talking about where those gaps are and everybody coming together instead of continuing to work in silos. Like, this is a community issue. This is and there's lots of resources out there, but it seems like there's none at times.
Yeah, like today, I
Right.
had no idea.
Yeah, I was talking about it like 3 months ago because I'm doing an event in Odessa, very rural, and then one of the West Texas Counseling Stand. I'm like, oh. So then I talked with them and I was like, this is an excellent resource.
Yeah,
This
this
is
is
like,
like-
yeah.
And what is the likelihood our law enforcement actually knows about law? And how many
Yeah.
calls do they make to military families that are not being connected to that? It's things like that.
Yeah, because I see it all the time, especially on Facebook. My husband is not letting me have money, blah, blah, blah. I don't know what to tell them. Yeah, on the Facebook spouse groups, and I don't know what to tell them because I've never been in that situation. And then they might not trust the command. There's really not resources for
Right.
spouses,
That's what we do.
And civilians really do not understand how much the women veterans go through. Just one example, sexual assault. Of course, you don't want to go to your commander. And let's face it, it may be the commander. And then let's just give you a short overview of it. Say you get out the military. Now, I'm only talking about the women. Now, this applies to the men also, but I'm only talking about the women. And then once you won't even apply for your benefits because of the fear of in your mind, you're thinking you're back in that situation. So a lot of women do not even apply for their benefits and everything like that because it makes them go back there and they don't want to go back there. So one good thing about the military now, they're starting to have the clinics and everything to help the women military. But that's how come even when we started with this, I would bring up the women veterans only because I know how some of them feel and felt. Because I go to their different meetings and everything, and they're left out every time. Because just like what she was saying about how, well, people feel, the military got it covered, the military got it covered. But the military doesn't cover the women as much. So I learned some things from this, and I'm going to look up to see some of the training that they're going to have, because I am out there in the military community, even though I'm not a vet. A lot of people think I am, but I'm not. And but we know that our focus is women regardless, and we want to make sure that the female veterans know that they can also look to our summit to learn some things about the resources and different things that apply to them.
Would they be a tip list?
Wonderful idea.
You know,
And I feel, because I was a part of NOVA, but I never knew that part. We deal strictly with, the civilian side. Yeah, I'd never been related it to having, that whole other side of it.
Shall I have a suggestion? And this is just my type A personality coming out. We don't have to do it this way, but what if we create an outline to take a task at a time and tackle it so that we're succinct and we maintain focus? Kind of like planning a wedding, right? We have to start someplace, get that done, and then go on to the next task. That way we complete everything and we're not feeling like we're leaving things untouched.
right.
Or I wouldn't know where to start. So
You're absolutely right, because that's something I was saying. If we take a timeline on, okay, we want the invites to be finished, not mailed out, finished. How they're gonna look and everything. Then the next thing, but we have to first write a program, like a script. We have to write a script on what are the stages to the finish date. And then that way, we won't overlook something that, we didn't think about that. And then even it'll give us a chance to, constantly review our timeline on how we want it. That's like what I was saying about how even if we did it, not every single month, but every other month or something like that, then that way we can see what the next step is on our agenda as far as our description of what is the end results on the day of the summit.
You all did create an outline in May, so I'll be sure that is on the shared channel as well. And then I can use that to start a draft task list, if you will.
Yeah.
With deadlines to bring this back to the August meeting. To fill in the blanks.
That would be perfect.
There's a reminder in that outline. I didn't even remember.
Right.
It's just like
It was so long ago.
when you plan a banquet, you have a start. It's like, okay, I got to get the speaker, and I've got who's going to do the tickets. We got to do the program and different things like that. And I mean, for me, I call it a script because it's like, okay, we got to do the next day one thing, and then that way you can look, say, all right, this completed, the next thing. Gotta get, whatever, what color.
Sure.
What color you're gonna wear, or anything. And then that way, we can always know where we're at instead of, it's like she said, duplicate. We don't want to talk about invites today and then 3 months down the line, we want to talk about invites again. That part is already passed. We don't want to something else so that we can have because we got to have an ending date for that part in order to, then we have a date that we can put to it.
Maybe you could use that to identify subcommittees or divvy out the tasks like you all have discussed.
I think that's a great starting point for you. Okay.
helps a lot.
Wonderful. I'll prepare that for the next meeting.
Thank you.
Okay, next item.
Okay, no action for item 4C. Item 4D, discuss and take appropriate action regarding setting agenda items for next meeting.
Michelle Cochran, County Administration, just based off of the last discussion, the next meeting, the only agenda item will be the summit discussion.
Okay, no action for item 4D. Item 4E, discuss and take appropriate action regarding the meeting date, time, and frequency of the Women's Commission.
Michelle Cochran with County Administration. So as I briefed you during the minutes review, this discussion came up, or this item was requested from the last meeting from Judge Chu. Asked that we add it to this meeting's agenda. And her thought was, you know, we don't need to meet as long as we have historically. I just want to bring the discussion up to see if 9:30 is still good. Maybe we put it to 10 if that works better for everybody as schedule. And the meeting could be an hour. Other boards and committees meetings are typically an hour. I would try to keep it to that. With the understanding that this last year was many presentations and research and trying to learn things. And so now you're in a different stage, if you will, with having identified your focus for now, anyhow. And so this was brought up, Commissioner.
Actually, I think we should put this to another month. Only reason why I say that is because since Commissioner Chu was the one who wanted to discuss this and she wanted this on as an item on our agenda today, I think we should discuss that when she's here. That's the only thing I feel, because she has her different ideas of why she wanted to say it. And for those who weren't at the last month's meeting, you weren't able to hear what she said. So that's the only reason why I think I just think when a person brings it up and they want it on the agenda, it should be more discussed in detail when they're here so that they can get their point of view why they wanted it on as an agenda item. But that's just my way of thinking.
That's fair. Makes sense.
To get Socha's opinion too.
Yes.
Yeah.
Definitely. How our schedule works too.
Okay. Well, I know I just said we'll only do the summit item
I know.
at the next meeting, but we can postpone this item until the August meeting as well, which I think is appropriate because the next meeting will probably be pretty likely since it is a requested work session for the summit. So I think we're okay postponing this item.
I think just one of the things she was looking at is making it within a time frame, an hour and a half, and a specific time. So if you want to think about your schedules.
Yes. That next
Gotcha.
time. Okay.
Can we have a motion to postpone?
Yes. I
second.
Commissioner Cristiano Zamora?
Aye.
Commissioner Bird?
Aye.
Commissioner Potts?
Aye.
Commissioner Chavita?
Aye.
Commissioner Kirker?
Aye.
Thank you, motion carries. That completes all the items on today's agenda.
Thank you.
Adjourn it. Okay, the meeting